Hi, everyone. This is Janet Hill at the Rock Island County Health Department. It's 3:30 p.m. on October 6th. Today we have the public health officials Nita Ludwig and Ed Rivers to talk about Halloween protocols and how we can have a safe but still fun Halloween. First of all, Nita, let's start off with some Rock Island County numbers, please.
Hi, good afternoon. Unfortunately, today in Rock Island County, we are reporting one additional death from COVID-19, a woman in her 90s who had been in a long-term care facility. This does make 87 total deaths for Rock Island County to date. In addition, we also have 22 new cases of COVID-19 for a total of 3,320 cases. Currently, there are 22 people hospitalized in Rock Island County with COVID-19 illnesses. And we do offer our deepest sympathies to the woman who passed and her family and friends. Thank you.
In Scott County, the number of cases is 3,339 with 29 deaths. With the advent of fall, families are starting to plan for the upcoming holiday season, starting with Halloween. This year, as with many things, it would be safest to plan special events at home, using social media and other meeting platforms to connect with family and friends. However, for those who choose to celebrate in person, CDC and the Iowa and Illinois Departments of Public Health are offering the following guidance. Consider lower or moderate risk activities that allow you to keep social distancing between individuals from different households, like carving or decorating pumpkins either indoors with members of your household or outdoors at a safe distance with neighbors or friends. Online parties or contests, for example, costume or pumpkin carving. Scavenger hunt style trick-or-treat search with your household members in or around your home rather than going house to house. Car parades, including contests for decorated cars, drive-through events where individuals stay in their cars and drive through an area with Halloween displays. Drive-in events where individuals are given a treat bag with commercially packaged, non-perishable treats, or a takeaway item from an organizer while individuals stay in the car. And dressing up houses and yards with Halloween-themed decoration. Other options include one-way trick-or-treating where individually wrapped goodie bags are lined up for families to grab and go while still keeping distance between individuals. Small groups, outdoors, open-air costume parade with social distancing. Outdoor costume parties where protective, not decorative masks are used and people can stay more than 6 feet apart. Visiting pumpkin patches or orchards while wearing masks and social distancing, or outdoor Halloween movie nights with local family friends with people spaced at least 6 feet apart.
Trick-or-treating and trunk-or-treating are mainstays of Halloween celebrations here in our community, and children look forward to this all year long. However, these events make it really difficult to social distance from other households and other individuals. And unfortunately, this day must look different this year. Here are some suggestions. For those who are wishing to pass out candy, please leave it individually wrapped candy on the front porch or sidewalk with pieces spread out to limit interaction with the trick-or-treaters. Set up the treat station at least 6 feet from where the front door is. Remember that children frequently show mild symptoms when they are infected with COVID. Wash your hands for at least 20 seconds before placing the candy on the table and when refilling. Wear proper face masks. A costume mask such as those worn for Halloween is not a substitute for a face covering. If face coverings are worn under a costume mask, please ensure this does not create breathing problems, and if so, discard the costume mask. For those wishing to trick-or-treat or trunk-or-treat, Wear a real face mask for the same reason that I just mentioned. Trick or treat with members of your own household only. Limit the number of houses or trunks that you visit. Do not crowd at a door and give yourself enough space between other groups. Stay local. Avoid the urge to attend events in other towns. Use hand sanitizer before eating any candy. And of course, you want to inspect that first. A few other fall activities are considered high risk as well. In-person Halloween parties that are held indoors. Indoor haunted houses because people are crowded together and potentially screaming. Corn mazes where individuals take part in groups, often with the members of different households. And hayrack rides that mix members from different households. In Illinois, these rides are allowed at 50% capacity. In Illinois, haunted houses may be allowed in some cities with enhanced safety and cleaning procedures. We at the health department have reviewed a few of these plans and have offered our suggestions. There's never a zero risk for any activity that we take part in, but all of the partners have worked very hard together to make it as safe as possible this year. Children aren't the only ones who look forward to Halloween, so we offer these as suggestions for adults and social gatherings. Try to avoid large gatherings with many people. Those are considered higher risk than smaller gatherings. Indoor parties or gatherings should include some social distancing, wearing masks, and of course frequent hand washing. The more time you spend at the gathering, the closer the contact, the more people, the higher your risk of COVID-19 is going to be. Our guidance doesn't just end with the celebration. If you participated in a higher risk activity and you feel symptoms, you should stay home. Avoid being around people at increased risk for severe illness from COVID-19, and consider getting tested for COVID-19 and stay home until you get the results. Stay safe this Halloween. Thank you.
Thank you, Ed and Nita, for sharing the information on Halloween, one of the next holidays that we know everybody is looking forward to and trying to see how we can address COVID as it relates to that. We'll go to some questions here. Give me 1 second while I pull through these. This is for both Ed and Nita. And we have Ed start first, and then we'll go with Nita for this first one after that. How hard is it to send these messages and find messaging when political leaders openly disregard social distancing, wearing a mask, and even suggest COVID is not a serious threat? A couple questions here, Ed, I apologize. Does the state level health department deal with this issue anyway? And do local health departments have a role in trying to deal with the messaging that people get from their elected officials?
Well, women all along to pay attention to the messages from the local health departments. Our charge is to make sure that you get the most accurate and usable information on how to protect yourself. And make these messages time and time again. They're simple. There's a few things that you can do, and you should continue to do them. Signal-to-noise ratio is very high in social media and on television, so your local health department is your best source of information.
Nita, do you have anything you'd like to add to that?
I would just add that we do know COVID is still spreading in our community, regardless of whichever political leader you have. And it's important to be vigilant and stay safe, which of course our tools to do that, our best tools to do that right now are wearing the face mask, staying your distance from other people, and frequent hand washing.
And I believe haunted houses, you said correctly, was not allowed in Illinois. Is that correct, Nita?
Well, this is kind of a different situation. Haunted houses, they really are under several different authorities, and that can be kind of a complex issue, as we have found out this year. The Illinois Department of Public Health guidance does not recommend indoor haunted houses for the reasons that I spoke about earlier. However, some of these venues are considered a performance venue, and they are licensed or permitted by other agencies like the Illinois Department of Labor and the city in which that is located. So if they have been permitted through the Illinois Department of Labor, they are still allowed to operate. They have shared those plans with the Illinois Department of Labor and have been approved. And they've also contacted the health department, and I've looked over all their plans. And again, you know, the risk is never going to be zero if you go out and attend these kinds of activities. But they have really taken every effort to make them as safe as possible. And certainly if anyone doesn't feel safe, comfortable, or, you know, comfortable with that, then they probably should not attend those activities.
Sorry, there was a follow-up question. What do some of the plans include for these types of, let's say, a haunted house that qualifies under that, as you mentioned?
Sure, so they have sold tickets in advance. They're really limiting one group at a time through their venues, and they allow enough distance. I believe at least one of them said, you know, the party would be 2 or 3 rooms away before another group would start. Some of them are having people not congregate outside to wait their turn, but they'll be in their vehicles, and then they will get a text message saying their group can go ahead and come in. So, and of course they're doing cleaning, regular cleaning every hour through the venue itself. So they have taken a lot of precautions, and, you know, they hope to have a very safe and fun event.
Okay, one last question, and Ed, I'm not sure, we were having a little bit of trouble with your audio, so we'll see if you're able to answer this. Do you have any response to what treatments are offered at the hospitals?
That would be a question you would best direct to each medical facility.
Okay, so if you didn't catch that, it was a little grainy there again. You would need to talk with each of the health systems in the area to see about the treatments. That was mentioned a little bit last week, so they would have some information for you. And then Nita, as a follow-up to the haunted house question, screaming might be a good way to release some of our pent-up feelings about life in 2020. Any suggestions how to safely do that?
Yeah, I love that. That sounds very appropriate for me some days too. I would say if you really need to go have a good scream, go outside, don't be near any other people, and then just let loose. But let your neighbors know so they don't call the police and think you're in trouble.
Great advice. Okay, it looks like we don't have any additional questions at this time. This information will be sent to you through our press release, and I know Scott County Health Department does have the Halloween guidance up on its site, and as well as some graphics that are being developed to be shared. So I'm encouraging everyone out there to have a safe Halloween celebration if they choose to do that. Thank you all for joining us. This is being recorded and will be placed on our website, so please feel free to go there should you need any additional information. And we look forward to talking with you later this week. Have a great afternoon. Thank you.
Thank you.